Good morning. Thank you for joining this month's Disabilities and Conditions of Aging Network. I'm thrilled to see all of you, especially since we're on a different Thursday in the month. Hopefully, we're staying away from everybody's holiday plans. So if there is anyone new, the goal of this network is just to create an opportunity for the different services, providers, and individuals who are working in the disabilities and conditions of aging communities to have a regular opportunity to connect, to talk about what they're doing, what they need help with, what they can enhance for other folks, and ways that we can celebrate together. So with that in mind, I'm Jeremy Warner. Walking Spirit is my organization. For those who don't know, it is a small business that I'm actually in the process of working with Indiana Vocational Rehabilitation to get to where it is sustainable. And that has been a very interesting process throughout the last year. We provide 3 services: accessible, diversity, equity, inclusion, and belonging, consultation and support, public speaking, and then also what I'm calling quality of life, adaptability, and advocacy coaching, which is really meant to provide an opportunity for people with disabilities and families affected by disabilities simply to talk with me about ways to connect with you guys. The idea is to have a complimentary conversation to get folks connected to the resources that can help them best. So that is what that service is meant to do. The other services are definitely for profit. And if anybody is encountering businesses throughout the public sector that you can't get into, or your family members can't get into, or you don't feel welcome there, even though they are ADA compliant, let me know. That's who I need to be reaching out to see if we can change minds and directions. So that is who I am. I am going to hand it off to the Career Center at Noble and give you a chance to talk for a sec.
Okay, sure. Kendall's not here at the moment, but I'm Travis Norwood. I am the new CEG facilitator at the Career Center for Noble. CEG is Career Exploration Group. My job is to lead those groups and teach the curriculum that we have. Our program is aimed at anybody and everybody, whether they be on the autistic spectrum, they have an IDD. Our job is an 18-month program to teach them soft skills, life skills, do some volunteer work, do some work shadowing, and it's all hopefully community-based. We're located off of Shelby, and we're trying to get our program started again because it was killed in COVID, or put on hold, I should say. And we're looking to start back up at probably the middle of January, middle of next month. So I've only been here a week. So I wish Kendall was here to give you more of a good, thorough rundown, but that's what I know. And yeah, it's nice to meet you. I'm sure I'll be in contact with many of you in the future.
Yeah, it's a pleasure to have you join us. When Kendall comes back in, we'll give him a chance to jump in as well. Kristen Ludeker-Siebert, would you like to fill us in on what's going on in your part of the world?
Yeah, my name is Kristen. I am the Executive Director of Coordination for a Healthier Hamilton County Systems of Care. So I'm the System of Care Coordinator for Hamilton County. In my neck of the woods, I have a lot going on. We continue to, I continue to facilitate the Stronger Veterans, Stronger Communities, Veteran Service Member, their families and caregivers, Suicide Prevention Coalition. We have our planning grant application at IDVA right now, so the Indiana Department of Veterans Affairs. We are waiting to hear back if we got everything we asked on that, which will be just a 3-month planning piece to create the 24-month implementation plan. So we'll create the plan and put together the implementation grant, and that's when we asked for all the money. So we're still in the middle of that. Recently, we were granted funds from the Hamilton County Health Department. We are doing an initiative with ChildCare Answers called Bridging the Gap. between pregnancy and the 4th trimester. And we want to be able to get in front of expecting parents in regards to their child care options. And we want to really open up those options to not only your traditional, you know, hey, go here, big places that have waiting lists, because honestly, the waiting list in Hamilton County for a child care seat right now is 12 months, and like nobody's pregnant for 12 months. So it's very hard, right? You have to kind of switch your life up. So we want to get in front of people as soon as we can and let them know that there are, you know, other options than just, you know, the big places you hear of KinderCare, for example. But there's also how to take things into consideration. So like your family culture, your you know, hopes for your kids in that environment. And an example I use is because I did not grow up here and I live in Carmel, I would not have been comfortable sending my child to an in-home daycare. Now, once we get up to Sheridan, Cicero, Atlanta, Arcadia, they live there for 3 generations, right? So like the in-home daycare down the street is the aunt of a girl you went to high school with. And so I would understand in-home daycare there, and they may be strange about, I don't know these people that in this bigger daycare watching my child. So anyway, all those types of considerations, that's part of that program. Oh, what else do we have going on? We're doing the youth panel on May 1st, 2024, and I think I talked about that last month. So still, if you have any ideas on any youth or any even adults kind of representing younger youth, we want to get the whole gamut of 0 to 17. I've got, you know, junior, senior, sophomores interested. I have 6th grader, which I'm super excited about. But those other grades in between, if you have any ideas or someone you work with or the parent of someone you work with that would like to speak to it's youth glimmers. So glimmers are the opposite of triggers. So glimmers are those things that are protective factors for us, give us strength, want us to keep going. So that is the theme of our panel. And we're really looking at those out of school time activities that are glimmers. You know, the kid is 4. Why do we get them involved with soccer at 4? You know, so kind of talking about that. I'm sure we have other things going on that I can't think of right now. Anyway, Jeremy, I wanted to let you know that your name was brought up Tuesday. It was Tuesday. I was in the Hamilton County Executive Director group, and resounding joy, just moved to a new location, and they were talking about making their space accessible, and then we were also talking about making websites accessible. And Lindsay brought up, she's like, does anybody know Jeremy? And I was like, ooh, and she's like, well, yeah, of course you do. You introduced us. But, you know, she was like, Jeremy is great. If you want someone to come and put eyes on your building, put eyes on your stuff, make sure that it's accessible in all sorts of different ways. Jeremy's a great person to contact. So we gave out your email address just in case any random person starts contacting you.
Wonderful. Thank you so much.
You're welcome.
And you can also steer folks to walkingspirit.org. I just added a kind of a lead section there of if you're encountering any issues, you know, let me know kind of thing. So yeah,
Awesome.
and that will email me directly if somebody puts something on there. So
Oh,
thank you.
perfect. Okay.
You know, and while I have you, so I meant to include the fact, considering that we are in the holiday season, to ask folks to also share if there's anything going on within their organizations to recognize that. And even at a personal level, if you want to share anything about what your holiday traditions are, because I find more and more that we need to be aware of the fact that there are multiple holidays taking place right now. And while I'm not Jewish, I swim at the JCC 3 days a week, and I've been watching the menorah gradually, you know, get to where was only one light left that wasn't lit up yet when I went in last night to swim. So that's been an interesting experience. The other thing before I move on to the next person, because you mentioned glimmers, Kristen, that brought to mind the fact that Walking Spirit actually later today is talking with RHI Sports about ways to bring an adaptive martial arts program to their sports programming. And that is something I know the sensei that will be leading that is open to people of all ages with disabilities. So,
Oh my gosh, Jeremy. So I have a good friend in Kentucky who does adaptive martial arts.
very
Like
cool.
that's part of his thing. So I will connect you.
Very cool. That'd be awesome. And Krista, if you would like, do you want to go ahead and talk
Yeah,
about what's going on in your
absolutely.
side of
Yeah, I can connect. So my name is Krista Martin. I am with Direct Employers Association. I'm the Disability and Community Outreach Specialist for those of you that don't know me. We also co-host the U.S. National Labor Exchange, so I'll be plugging that for searching jobs, internships, apprenticeships, employers, and more. We have other free resources for our community partners to improve positive employment outcomes and employer engagement for those that you're serving in the area, and better connect with our awesome member employers of Direct Employers Association. So we work with the Indianapolis Disability Talent Showcase and the Work to Include coalition around employment first throughout the state as well. Those meetings are the third Thursday of the month from 1 to 2 p.m. They are hybrid via Zoom, same Zoom link every month. I'm going to put this stuff in the chat for you guys too. And Susan's on here. We're so excited. Big thank you to Easterseals Crossroads for hosting us over the past year after we kicked things off at our place on Woodland Drive. But accessABILITY is our new hybrid in-person host. So we are moving that meeting up from the holidays to today, to the second Thursday of the month. So hopefully folks can join us. I will be there in person. I don't think I've been in person since we kicked off last September in our offices here at DE. So I'm super excited to be here with you guys this afternoon and kick things off with accessABILITY, which is your Center for Independent Living. And I won't steal Susan's thunder. I'll let her, say all the good things about the SIL here. But we just, it's a pleasure. So if we can help you and your employment things, whether you're working with people with disabilities, veterans, and others, we work with our community partners and provide a lot of free tools and resources, again, to better connect folks to employment with our members. So yeah, all the good things.
All right, thank you. And since you mentioned her, Susan, you're next.
Hi, thank you. Susan Ferguson from accessABILITY, the local Center for Independent Living. We serve Marion and all the donut counties, and we Center for Independent Living. It is our pleasure to walk alongside people with disabilities on their personal journey to independence. So that looks different for every single person, and we provide advocacy for that. We also do a lot of really have ramped up our disability trainings in the community as well. So if people are looking for training on working with people with disabilities, those kinds of things, please contact us. Yeah, so that's what we do here. We've recently moved to, Jeremy mentioned our open house. We recently moved to an office in Keystone Crossing area, and so have the ability to host that meeting for inclusive employment this afternoon. We're super excited about that partnership. And I can't think of anything else new right now. So thanks. I'm happy to be here.
All right, very good. Happy to have you with us. Staying with accessABILITY, Sonia Eisenhart. You are muted. There
Okay, yeah. Took a minute because I'm in my car, I'm traveling. I'm an advocate for accessibility. And Susan pretty much said everything. One thing that I will add is something for the new year is I'm working on community mapping. And that is where we actually accessABILITY would like to go and visit and tour your place of business so we can then tell our consumers what to expect and what's accessible. Let them know that if they park on the north end of the building that they would have the accessible door to them or something of that nature. But that way we can then go, okay, this is what you do. And we're versed on your services, so we're no longer sending people to this place and they call us back going, they can't help us. They don't have services for us, whatever the case may be, we can kind of put a stop of just passing people around. That we know that this is a service, this service, this service, and this service provide this, and you can contact them, and this is who you can talk to, kind of thing. So that's kind of all I've got. Thanks.
Wonderful. Thank you. Heather Wildrick Holman, would you like to talk about Firefly?
Sure. Good morning, everyone. Heather Wildrick Holman with Firefly. Specifically, I'm the Assistant Director of Community Partners for Child Safety of Marion County. We are definitely in the throes of Hope for the Holidays. So it's our annual way to support our various families. So doing a lot of running back and forth, grabbing the gifts from our headquarters, bringing them back so our caseworkers can go and deliver those out to our families. If you're not familiar with our program, we are a free and voluntary in-home case management program that connects families to resources that can help them achieve their self-identified goals. So there is a program like ours all across the state of Indiana. If you Google community partners, it should take you to a site on the Indiana government website. And there is a map that tells you all the local regional offices in your area. Some neat and I feel like exciting initiatives we want to quickly share is in the new year, we will be launching something called K-Launch, and it will be a text message service that will be sharing a variety of child safety topics to folks that subscribe to the phone number. I think we'll also be sending those out to our clients, just a variety of child safety information. So I definitely will be wanting to think about making sure that that's accessible, whether it's infographics and things like that. I've got my thinking cap on there. Another thing I wanted to share is that we, not just our program, but we are partnering with our survivor advocacy program for a really neat initiative, restorative justice initiative with Domestic Violence Network, specifically in the 46218 Brightwood area of Marion County. So looking to engage families in that specific area in a restorative justice model around healthy relationships and things like that. We know for a variety of reasons, folks sometimes do not want to engage law enforcement and things like that when they've got some different issues going on in their family. And we are excited to see how that that rolls out in the new year. So yeah, thank you.
Wonderful. Thank you. Please let us know if there's how we can help support all of that. All right. Next, people moved around on me. Tim Vermand, would you like to say hello?
I will say hello. I'm not sure what else I have to say today.
Okay. Any news on the transportation side of things?
No.
Okay. For folks who are wondering, Tim had brought up the fact that there were lots of challenges with transportation for people with disabilities, specifically with Indigo. And so that is something that we've both been trying to connect with them more. And we also learned that Kendall from Noble is also part of the MAC. So that conversation's sort of been ongoing. And just so you know, Tim, I was able to connect with somebody at Indigo. I can't think of her name right now, but it was Kendall who put me in touch with her. And I am hoping to get her to be able to attend a meeting sometime soon.
Okay. I did apply to be on that group. I haven't heard anything.
Oh, wonderful. Kendall, do you have any update there on when, like where you guys are with that process?
I have to unmute before I talk. Gosh, it's conceptually difficult. So the MAC, where I know we are interviewing members at this point. I don't know. I haven't seen that application come across my email, but I'm pretty low on the tiers of email. So But yeah, I know there are new members coming, but even if you don't become a member, the meetings are public, so you can have almost as big a voice as any other member by just showing up.
Wonderful.
So I encourage you to show up.
Oh, I intend to.
Very good. Tim, anything from the United Methodist side of stuff?
Oh, I'm trying to track the Blue Christmas services that are accessible and offer ASL interpretation, which taken a lot of my time.
Okay. So when you say Blue Christmas, is that a specific program?
Oh, it's not a specific program, but it's something. Shortest day is another term, longest night,
Okay.
with different emphases that different churches and other groups offer, recognizing the seasonal affective disorder.
Okay. Very interesting. I don't know if ours does. And, you know, so Tim serves on what is the name of the actual committee?
One is the United Methodist Committee on Disability Ministries, and the other is the United Methodist Committee on Deaf and Hard of Hearing.
Okay. And so interestingly, I attend the Methodist Church at 38th and Meridian, and you're fine. Okay. Sorry. I attend the Methodist Church at 38th and Meridian, and on October 18th, which was the anniversary of my car accident, I was asked to speak, and they have, ever since COVID, broadcast on YouTube. And so Tim reached out to me afterwards and brought up the fact that the captioning was not there. And so they were not really able to send my, send out the link to my presentation from the church because that captioning wasn't there. That was a very interesting thing for me to learn, and something that I need to get across to our church about making certain that they are more accessible from that aspect. So. And that also shows that I'm not watching on YouTube. So, all right. Tim, anything else?
Nothing comes to mind right now.
Okay. Jump in if there's something else that you think of. Allison Weimer, would you like to fill us in on more from the GCPD?
Hi, I'm working from home today. I've been fighting off a fever for the past couple days, so my holidays, well, at least our office holiday celebrations are fighting off sickness. It seems like everybody is getting sick. But I am the systems change manager for the Governor's Council for People with Disabilities, and we service people with developmental disabilities. So those are our consumers. And we follow the Developmental Disabilities Act. So that is what our council does. So what we've been doing lately is federal reporting. That's what we're knee deep in. And until the end of the year, because it's due the 30th, the end of this year, 2023. So that's basically what we're all focusing on. But after the new year, we have a number of projects that we are putting out, some RFPs that we're putting out. So that will be really exciting. And then so look for that on our website. We'll be putting those out. And some of them have to do with some of the stuff that I'm involved in is youth chapters. So I'm really excited about that. I've been pushing for that, trying to get more of a presence with middle school and high school youth chapters, because there's a whole lot in the community for people with developmental disabilities, in terms of advocacy, after high school. But what my goal is to kind of get advocacy going before the end of high school, so that kids know what, you know, their options are, what, you know, their career paths, all kinds of things. There's so many things out there, so that they're not just hit after graduation and they don't know what to do, or that they're reliant upon a caretaker or something like that. So, you know, we're focusing on autonomy. And then of course, I talked about this the last time we met, but I'm still, we're going to be implementing our service dog training. So that'll be really exciting. I've partnered with a couple of our self-advocates who have service dogs as well. So that'll be really cool. So yeah, that's about it. I mean, we've got a lot going on, but that's all I can say.
All right, fair enough. And without putting anybody on the spot, that's not my intent, but are you and Kristen talking about your youth programming that you're both doing? Because it seems like there's an opportunity there.
No, this is something that we've just been kind of putting out, you know, like I've been talking about it with my director. And so it's very in its like baby stages. But you know, since we're focused specifically on people with developmental disabilities, that's been, you know, what we want to
Absolutely.
you know, to talk to. So you know, to different agencies. I wasn't sure, we weren't exactly sure like who we wanted to talk to about it, whether, you know, it was Department of Ed or whatever. So I'm happy to talk to Kristen about it, if, you know, and partner. So that sounds great.
Well, yeah, I feel like there are some great connections here, especially within youth programming and making certain that youth with intellectual and developmental disabilities are included in that, and just you having the ability through their programs to be able to raise awareness of what you guys are doing as you get that off the ground. So yeah, I hope that that's the kind of thing that this network is helping to create and support. So,
yeah.
Right.
Yeah. I also wanted to say a lot of the projects I've been hearing about are so amazing, and I am so excited for all of the stuff that you guys are doing. I'm going to bring that back to my team and just share with them what everybody's doing, because it just sounds so great. And I especially am interested in Sonia's project with you know, the accessibility. I'm actually on the Indiana ADA steering committee, and so I would really love to bring that back to them. I think it's really interesting and really important. So yeah. Anyways, that's it.
You mentioned the ADA steering committee. I was just speaking with Rick Edwards the other day, and he was talking very much about wanting to get that get that steering committee supported. And so if anybody here is interested in that, I know Rick would be happy to talk with you. I'm sorry he wasn't able to join us today, but so yeah, let me know if that is something. I could certainly connect you guys with him. So Chalicia Howard, would you like to say hello?
Yes, I would. Happy Thursday, happy December, all of that. Let's see. I think that most people on the call are probably familiar in some capacity with Caresource. and have some sort of a contact. So I cover Central East Indiana, but occasionally I'll do things like pop up and support community events in Terre Haute and in other places. So for the 2024 year, well, first, tomorrow, the 15th, is the last day of open enrollment for those with the HIP and Hoosier HealthWise plans. So we've been very busy with trying to make sure that people know that, and that whatever plan they elect will go into effect on January 1st. And then for those who don't fall within those income thresholds, who are above those income limits, the marketplace enrollment period ends on January 15th, and those will be for plans that will begin February 1st. So we've been pretty busy with that because open enrollment started on November 1st. So we've been out in the community, just all the boots to the ground, being at every event that we could possibly cover. I think that we've covered a lot of ground just because we found out that just as a combined group, there are 5 of us on our team, not including our manager. And I'm pretty sure we were talking about, I think it's rounding out to look like we covered a total of maybe 700 events across the state this year. So, and that's from January to November because we don't include December. So yeah, so we've been staying very busy. But for the 2024 year, we're planning on expanding some of our life services program availability. So what that is for our members, adults and children, we assist with, employment, we assist with adult members going back to school or for youth finishing school, childcare, any of those types of, things that could be a barrier to someone. So we also, if the child, so for example, if a child has Caresource, the parent automatically still qualifies for those programs with us. So we would still be able to help the parent of those children to go back to school, or we have a Rides for Food program. So that is free to our members or the parents of our members. And we do 5 round trips monthly for curbside grocery pickup or food pantry servicing or any of those things. So, and that's separate from the non-emergency medical transportation as far as, appointments, going to the WIC office or doctor's appointments or any of that type of thing. Those things are automatically included for our members as well. So with the life services program, one of our biggest things in there is that Job Connect, because we partner with hundreds of employers across the state. And so our members typically tend to have priority with the interview process because of our relationships there, and with interview coaching and job coaching and all of that. So we're just hoping to do some more in that area. And then we, of course, have the youth and adult reentry programs, and just trying to, keep youth out of trouble who have already been in trouble, helping them once they're released to go on and finish their education and keep them on the right path. And the same for the adults. We are trying to expand our affordable housing partnerships with different facilities across the state. So that's something that we're really focusing on and seeing how we can really increase the housing. Because, you have plenty of people that are like, okay, great, there's affordable housing, but of course there isn't enough. So we're trying to definitely figure out something there. And we have some stuff in the works for 2024 with that. Also, we launched mid-year this year, but really plan to push into 2024. We have what is called Be Me. Be Me is an application for youth mental health. So with that, it's an app for teens. It's a teens only app. So Caresource members get it for free. They receive all the services for free. And what it is a platform that teens can talk to other teens. And there's also behavioral coaches and everyone on hand, and to give you feedback to where, let's say a teen is in an uncomfortable situation or setting with friends, or if something happens and they want to tell someone, they can text the behavioral coach and say, this is, what I'm experiencing, and it helps deal with peer pressure and everything. And so the board that's over the app is actually teens. So they get to regularly update and talk about what they're dealing with. And then there's also screening tools in there as well for any type of, there's mental health screenings. So, and depending on the scores and the things that are being put in, it will kind of notify the whoever the child's provider is to work on that referral base to say, in a sense, to say, this child might need to talk to someone further, or, they may be experiencing different things. So I'm really excited about that and where that's going, because we've already had a very big positive response to that. We're also just working on expanding access to things for the immigrant populations in the upcoming year, because in India alone, there are over 40,000 Haitian immigrants. And then the Burmese population has definitely picked up. And of course, there are also immigrants from, other nationalities. So we're just doing what we can to assist there, try to provide more resources. And then lastly, we have started that in the new year with our marketplace plans available. We have a new diabetes plan. And so what that does is provide discounts before hitting deductibles for those with diabetes. But you don't have to have diabetes to enroll into the plan, which I don't know why you don't have to have it already, but that's just a thing. But we're already getting some positive response on that. Like the community is really excited about that and all the things that come along with that, all the assistance and extra enhanced benefits of no cost that are available. So I'll stop there.
Thank you very much. All right. So Kendall Tilton, you were out of the room when I called on Noble. Would you like to fill us in a bit more on what's going on over there?
All right, now we're unmuted. It's a two-person operation now. It's even more complicated.
That's funny.
So my biggest thing to focus on right now is launching the program with Travis, but we are, I guess you talked about housing. We are working with another developer to provide a similar situation to what we have at Passages, where we'll be providing vouchers for adults with intellectual disabilities that will allow them to rent apartments for 30% of their income. So that would, I believe, include the utilities. So it's 30% of their income is their living expense, which is exceptionally helpful for people's budgets. So we're looking at that in this next year coming up. So again, and that's an exciting possibility for us. What else do we have going on? Our family support network is really kicking off with I don't think she's on today, but I think Jonna was on last time. Introduced herself, so our family support network. So working with 2 generations of a family, so with parents and children. So if the children have needs, we're also helping the parents with life coaching, career, connecting people to services. So that's been exciting. So if we have any families, and we're particularly targeting kids in First Step, because it sort of makes a cohesive group. Those parents tend to work together and understand each other a little better. That's all the new stuff that I have right now.
All right, wonderful. Thank you. Okay, well, before I let everybody go, and I feel like I'm going to give everybody a holiday gift of an extra 15 minutes in your schedule, unless anybody has anything else that they want to add. Allison Weimer, I want to thank you for the comment that you shared about hearing about all the different programming and how important that is, and being able to share that. Because honestly, that's the best holiday gift that you could have given me. Thank you.
Oh yeah, sure, absolutely. I'm happy that I was able to give that to you.
you know, the purpose behind creating this network, when it originally started, I was doing outreach for a home healthcare company, and they wanted me to create a network for them. But as I got into it, I realized that this really was a network that needed to be separate from that and very much focused on exactly what you brought up, of giving everybody here an opportunity to hear about what's going on, recognizing that repeated services in a system that's overwhelmed is a good thing, and understanding who's doing what services differently so that we can get the diverse consumers that we meet to the right people for them is the whole point. And thank you so much for giving me a little bit of validity that's what this is doing. So
Yeah, sure. I also wanted to add, I've been a participant of a care coordination Department of Health group that they did a training back in September, and it has really been motivating to me, at least, to see the need for that. It was specifically for children, but it really has motivated me to see the need for care coordination for just people with disabilities in general, and that there's such a disconnect between all the agencies in Indiana. So the fact that we can all talk together and then maybe partner with each other, or at least know what we're all doing so that we can, bring each other in. I think that that's so beneficial. So I love that you're doing this, and I really look forward to these meetings. So
thank you all for being here. Thank you all for supporting the network continuing for the last year. Really, I think we're at a year and a half,
year.
I think. Yeah. And so, yeah, it's thrilling to see. And as we get into 2024, if you would please think about who isn't here and invite them. And if you find out that they're like, oh, I would love to do that, but I can never make it on the fourth Thursday at 10 a.m. I'm absolutely open to us exploring other times if that's what we need to do. But so
I have a quick question for Chalicia. When are y'all coming back to Woodland Drive? Like, we've been talking about you all week. Like, where are these Caresource people in this building? Like, I'm on the second floor, you're on the first.
Yeah, I don't know. I can definitely figure that out for you, though. I
Well,
do
we
know
were just curious. We're like, where are these Caresource people? Like,
well,
wait,
one
do
of the
they actually have an
unfortunate
office?
things,
yes.
Oh,
yeah, but so
Not putting you on the spot or anything.
no, no,
Miss
no,
Edwards,
no,
but,
no.
you know.
So it's usually only like 2 to 3 people that are up there. Like, that's usually it. I was just there the other day.
Oh,
But so yeah, I'll have to stop in and see you, because I'm sure you're familiar with
well,
Chad then.
well, I am, and I'm not here every day. I'm only here quarterly. So I've been here, I was here this week,
Yeah.
for our quarterly meeting and Hollyburn and all this, and stayed, for the showcase and stuff. So
Yeah,
yes,
we're
we'll definitely
barely
have to
there, but
coordinate.
yeah, I can definitely work on that, because yeah, it's very slim up there.
Yeah,
It's
well, we
very
were just
slim.
joking about it all week, and then we saw Caresource somewhere else, and then I literally texted my colleague. I was like, "Caresource is in my meeting."
how funny.
Yes.
Yeah,
All right.
that's all I got.
Wonderful. Okay. Well, happy holidays to everybody. I hope that you take some time off towards the end of the year and the beginning of the new one. And we will see you all in January. So
And hopefully we'll see some people at 1 o'clock at accessABILITY.
that too. Yes.
Happy holidays, everybody.
Thank you.
Bye, y'all.